Hey everyone, my name is Jamie Hutchison Hutman. Some places it says Hutchison, some places it says Hutman. I'm making this video about my first clinical experience. So far, I've had 3 days with my preceptor. Um, it has honestly been so wonderful. I've really enjoyed having some independence and really putting to use the skills that we learned in our health assessment class. Although I'm doing women's health, my first clinical is at like an urgent care. A friend that I used to work with works at an immediate care associated with the hospital that I work at. And so she had said that she would be willing to precept me, and I thought it would be a really great first experience to kind of just get like a broad picture of everything that, a primary urgent care would see on a daily basis, not just women's health focused. So, the practice is with my friend who's a nurse practitioner, and then one other nurse practitioner and two physicians. I go every week, sometimes twice a week, and it's really just like a broad spectrum of things. It's a lot of like a patient first kind of complaints, like women come in with UTIs or like complaints of a potential STD or a lot of allergies right now, upper respiratory infections, and I'm trying to think what else have I seen. We've Because of where it's located, it's also a primary care office for the students of the university. So students that come in and need just physicals to be cleared for their clinical rotations, or if women need like their routine pap smears or and things like that. So it's been really great. I've been able to. The first day was really observational. And by the second day, my preceptor was letting me go in ahead of her and kind of take the history, review symptoms, do my assessment, and then she would come in and then go again. We always will ask the patient, are you okay with this Jamie is a student, are you okay with her doing her assessment with you? Sorry, my dog is Ginger, stop. um, so, and most people are really receptive because their employees are students at the university, and so they understand that it is a teaching facility. So, I haven't had a problem with anybody being like, oh no, we don't want her doing it or whatever. So, um, I have gotten to accomplish a few of the goals that I wanted to. I really wanted to do a pap smear because I'm doing women's health, and yesterday was my third day. My preceptor let me do that, so that was really cool. I had watched her do about 5 of them, and then so she let me do one, which was really nice. Um, it's been good. I've been practicing a lot of the documentation. As annoying as Shadow Health was, it was a really good practice for the actual notes that I'm currently writing. So that's really good. I have noticed that um, in my time as just a registered nurse and reading through physicians' notes and nurse practitioners' notes, and now I'm actually writing them, how much actually has to be put into them and properly worded and documented, and you have to pick the right billing code. And so I've really been able to apply a lot of what I've seen in my practice as just a registered nurse, and also in our health assessment class last semester into my current clinical, which has been really eye-opening, because you always learn about things, but I feel like it's hard to really grasp the concept until you're actually doing it hands on. So, I can read a textbook all day, but then, reading about clue cells and rods and things like that you see on like a wet prep, um, on a pap smear or a vaginal exam, you can read about it all you want, but until you actually do it and you look at it under a microscope, which is what I have done actually a few times, you don't really I don't really process it until I'm physically doing it. So I've really been able to, just in 3 days with my preceptor, been able to take so much of what we've learned in mainly the last semester, I feel like, in terms of actual hands-on health assessment and the reproductive health class, um, and apply it into what I'm doing now. And so it's been really cool for me personally, because I just love taking what I've heard about and been lectured about and actually being like, oh my gosh, I know what a drawer test is. We had to do a drawer test yesterday, and I was like, oh my God, I know what this is. I learned this. It's really, it makes me really excited to like keep moving forward in our clinicals and moving forward as an NP. Um, I where I currently work, it's not a huge flow of care between the physicians and the nurses. It really should be, and it's a huge problem that the unit that I'm on faces. But so I really get a lot of pushback from doctors where I'm working and residents and things like that. And so it kind of had me in, one perspective. I've only ever worked in this one setting, so it kind of had my opinion already formed about, how residents are and how doctors are because of where I work now. And not everyone is like that, but I definitely get a lot of negative vibes of like, oh, you're just a nurse, you don't, your opinion doesn't matter, and it should never be like that, but where I work it is. And so then now being in the setting of my clinical, the doctor, the head, like I guess he's like the head doctor in the office. He is so nice, and he's really, really receptive to me and as a student. And like if he's in a room with a patient and he sees something interesting, he will come out of the room and get me and say, hey Jamie, do you want to come in and see this? Or and things like that. And like, or if he looks at like a pap smear, wet prep cells under the, not necessarily a pap smear, but like a wet prep or a vaginal swab under the microscope, and he's like, oh look, this is a perfect example of clue cells, or oh, this is a perfect example of yeast, and he'll grab me and he'll let me come look and he'll explain it to me. And so I don't get a lot of that where I work, so not that I necessarily should be, but it's really eye-opening to see how different physicians work differently. And so um, I really felt really welcomed and warm feelings, and a very, I guess, like I feel able to approach the doctors and NPs in the office outside of my preceptor. And so it's been really nice to have that feeling that I don't necessarily get on the unit that I work on, even though the unit that I work on is at like a high risk OB, antepartum, and postpartum unit. And so I try to, see things that are unique to me that I could take with me as an NP, especially now that I'm in school to be a women's health nurse practitioner. When I know there's a patient with like a unique case that, I mean, we see a lot of the same things, high risk cases with these women. And so when I see a woman that has something that I've never seen before, or has like, if they're doing a speculum exam and things like that, that I'm gonna be doing, I don't necessarily get the feeling like, oh, hey, Jamie, come watch. We know you're in school, even though they all know I am. So being at this site has been really nice because anytime one of the providers sees something or is doing something women's health related, even though it's not a women's health clinic, they grab me and they're like, oh, hey, we know you're doing women's health. Do you want to come see this? Or do you want to come do this? Or do you want to come, do an exam on this? And so it's just been really nice. And I'm just having a overall really great experience, and it's only been 3 days, so I'm really looking forward to the rest of the semester and just seeing what it has to offer me and teach me. It's been really great so far, so here's hoping it continues.